Good to see you all. Because we've got a couple of new faces tonight, we'll go around the room and just do some introductions just for our new faces that are here. So I'll start. I'm Catherine McAreevy, chairing this evening. I'll go to my left.
Caroline Smith-Wright, Vice Chair.
Ryan Patterson, Drayton Western Rule.
Alexander Binder, Councillor for Grove Hill.
Belinda Williams, Woodall Farm.
Jan Madden, Nash Mills.
Pete Haddle, Bennett's End.
Mary Link, Upsling, Corner Hall.
Heather Pound, Cambridge.
Kevin Miller, Chair of the Decorum Patients Group.
Edie Glatter, Decorum. It's not patient. I'm not just a patient representative. It's Decorum Health Action Group.
I'm Philip Abbott, Chair of the Decorum Health Action.
Evening, all. James Doe, Strategic Director for Place at Decorum Borough Council.
I'm Jenny Webb and I'm the clerk for this evening. Work for Ladies Support.
I'm not a member of the public and a parking assistant.
I'll have a word with you. I'm David Taylor, MP for Hammerhurst.
I'm Adrian England, Leader of Decorum Council.
Thank you. So we will move on to our agenda. First item is minutes. So we don't have printed minutes anymore, which was a question that we were asked. So it's more video minutes. I don't know if anyone's seen them, have seen the videos, had any questions about minutes? No?
I did actually see them.
You did?
Finally, with difficulty.
Okay. I'll have a chat with Jenny. Maybe we can send a link to you for future, just so that you've got a clear link of where to find them. Would that be helpful?
It would indeed.
Are you happy to do that, Jenny? Thank you very much. Much appreciated.
Can I just ask why we're not getting printed minutes anymore?
You certainly can, and I will direct you to James Doe to answer that.
Is this going to be for all?
So it's for all committees now. We've moved to that for all committees, and I mean everything is recorded now. And when if you look at the if you go onto Modern Gov on the DBC system, which members will be familiar with, there are then like mini clips of each item as well. So you've got it broken down that way as well.
So the public can see the whole minutes?
Yes, I believe so. Yes.
Is it just audio or video as well?
Video.
Okay.
They're clipped, so action points are written under the relevant minute, and then it will say refer. So if you want to watch the entire item, you can watch the whole item, or you can just refer to the action points. It's up to you. It's on the BBC website.
No, as long as it's available, the whole thing's available for the public, I'm happy with that.
Yeah, it's on.
Thank you. Sorry, I must have missed that somewhere along the line. I've been away.
So we'll move on to apologies for absence. So this evening we've got apologies from Councillor Graham Elliott, and we have apologies from Councillor Sharon Wilkie and Councillor Laura Pringle. Any more apologies? Hello.
I'm not apologising, by the way.
Oh, okay. I would have been surprised.
Just curious, are we going to agree the minutes that we haven't got?
We are going to agree the minutes we haven't got.
Yeah.
Yes, we are.
So we are going to, because you didn't.
I am corrected by you rightfully, and thank you for that omission.
Just a bit curious how this is going to work now, because I haven't seen the video.
Okay.
So,
does anyone object to the videos that are online on the BBC website?
It would be really difficult for the video to be wrong, wouldn't it? That would be very sinister.
yeah. But we still have the formality of agreeing the minutes effectively, which I find a bit weird if it's a video, with all due respect.
We can watch it.
And be here till.
I mean, I don't know the solution to that because this is.
Sorry, Chair, perhaps if we can, Jenny and I can take this away and check in with member services tomorrow and see what's happened to them, and maybe we bring them back to the next meeting.
Is this a decorum issue, or is this other local authorities are doing this as well?
Well, a lot of local authorities have been doing video, certainly videoing committee meetings and maybe minuting them as well, but there has been a recent decision taken corporately for all committees at the quorum on video minutes. But I take Councillor Binder's point, you need to actually...
At the moment, I've got a problem with this, sorry, you know, that's the way it's going to go, that's the way it's going to go, but at the same time, the formality of agreeing the minutes hasn't changed as far as I understand. So it just seems a bit, you know, and if that's the case, why are minutes on the agenda if the video is de facto?
That's a very valid point.
I know the answer. It's because it's a meeting and you always have minutes on the agenda in a meeting.
Well, we always have written minutes
We're in
as well.
2024 now.
Okay, Councillor Madden.
I just, when I said I was happy with it, I hadn't really thought that through, but actually, if you're a member of the public and you want to quickly look at what's happened at a meeting, what you're suggesting now then is the only way to do that is to watch the whole meeting.
No.
No?
The items are divided, so the next item, for example, is declarations of interest. So if somebody wanted to know what the meeting memberships declarations were, they would go down to item 4, click it, and it would just show you the video of that item. So they're split up into the agenda items.
So let's all be very loud and articulate this evening.
Or in every meeting, because it's the
Indeed.
same across DBC, it's the same in all of the meetings.
So everyone's hands went up. So Councillor Hannell, did you have a comment
I
to
was
make?
just trying to make a suggestion about the way in which we can kind of come to a compromise over this. There's a possibility, I think, that what we can do is spend 10 minutes watching, if you like, the highlights, which would be the blocks of the videos that you can see about questions that are asked and answers that are given. In my view, if those people who weren't present at the last meeting, they will have missed huge decisions that were taken by this council at that last meeting before recess. And I think that probably would stimulate a discussion to kick off this meeting. We don't have those minutes to kind of like go through the action points and see where we are. That's the problem.
Thank you. Councillor Link, you had your hand
Yeah,
up.
mine was just going back to an apologies. I just wondered if you'd seen a message regarding Councillor Cox.
Yes.
Was she listed as being expected, but yeah, just wondered if you'd seen.
And actually, we also have apologies from Victoria Collins as well. So we'll go back to, there was another hand up here.
Yeah, mine,
about
but
minutes. Are you happy?
I think this is actually another discussion, to be honest.
I do as well. I think, I don't think we should spend this meeting watching the
Talking about
minutes,
minutes.
a video of the last meeting. So we'll review it and we'll. Oh, sorry, Councillor.
I have already suggested another meeting, SPA, the Scrutiny group, that we ought to review how this is working. Other people have complained about their inability to quickly interrogate what was said. And I can't believe all other councils are doing it exactly the same way. I've looked some up online and they're clearly giving more written information than just a bold statement of see the video minutes and nothing else at all. So I like it reviewed as a matter of urgency, so we can get some balance here. Thank you.
Some places have the video, but they might create an action log that is written, so that might be an alternative. But I think we'll leave it with officers and Councillor England to come up with a solution for our next meeting.
Just really quick point. If you look up there on the public website, the minutes are there divided by item. I'm watching them now.
The written minutes or the video?
No, the video.
Oh, okay.
So if you miss the meeting, it can be like you were actually there.
I agree that that's not the point really.
Were there? So I think we've we recognise there's an issue with minutes, and that's something that will be taken forward. But I think for this evening, we'll move on. We'll just say a quick welcome as well to Dr. Fernandez, because missed the introductions, but I know you've been here before. Okay, so we'll move on to declarations of interest. So as usual, I've got declarations of interest, but I just remember them all now. So designated nurse for safeguarding at Herts and West Essex Integrated Care Board, community nurse and health visitor at Hertfordshire Community NHS Trust. Any other declarations of interest? Councillor Madden?
I'm a member of the Decorum Health Action Group.
Thank you. Councillor Hannell?
I'm a paramedic working out of North Kensington in London Ambulance Service and also work at the National Stadium, Wembley.
Thank you.
Yeah, I'm also in the Decorum Hospital Action Group, I guess.
Thank you. Okay, so we will move on to public participation, and we do have a question this evening from a member of the public. Philip.
Thank you. Government figures show that the number of people over 85, the group that has most need of NHS services, and especially hospital care, will grow by 62% in the next 20 years. The numbers over 65 will grow by nearly a third in the same period. Using its seat at the table on the Hemel Health Campus project, could the Council explain how it will ensure that the NHS provides significantly enhanced local and accessible hospital health services, which will be required for the people of Decorum? That's what I sent in. I just noticed that David Taylor is here. It may be ruled out of order, but I might follow up that. I'm perfectly happy if it's ruled out of order, but is the idea of a community hospital as put forward by David Taylor consistent with your Health Campus project? So that's
So what we'll do is, because the question that you've submitted is what officers have prepared a response for, and obviously we don't want to be putting any of the MPs that attend on the spot to deliver answers immediately. So obviously that's a question he can take away, and he's able to do that and respond in his own time. And we can always, in future, if there's any specific questions that you want us to pass on to him in advance, then let us know, and we can make sure that he or Victoria or Gagan have those questions in advance. So thank you. So in response to that question, do you have the response to that?
So very simply, well, from an office perspective, as we updated the last meeting, there is ongoing work between the Council, the ICB and the Hospitals Trust to work up the next stage of the feasibility study. I think the best I could do this evening, Chair, is to note the question and to relay that back to the NHS in terms of their planning for that, what they put into the study in terms of the needs for space within the project is going to be critical. It just needs to reflect what those growing needs are. So just to add, Chair, through you to Mr. Aylett, that I have forwarded your question on to both bodies really for them to take away and consider. Thank you, Chair.
Thank you. Thank you. Councillor England, I believe.
Yeah, I mean, hopefully this is a helpful comment to address the question you're putting. I've been going to presentations from the CCG and the local trust and now the ICB for 8 years, and consistently the message has got louder and louder and louder, and on top of everything, Keir Starmer and Wes Streeting are now saying it very loudly as well, which is that we've got to look at how we do healthcare in a reformed way, because the runaway train is running away. We've been so successful in growing our population and having people living to older ages, and we've been so successful at finding new treatments for things that previously we would have had no answer for. That we've created a situation where we've got to prevent disease and illness. Otherwise, we'll have to spend a huge proportion of our GDP on on hospitals. And we've also massively realised that hospitals, if you don't absolutely need to be there, are the last place you should be. And I'm not a clinical person, but I've been listening, and that's the message I've heard. So I want Decorum to have the biggest improvement in its health facilities that it's seen for a quarter of a century. And if the feasibility goes well, then that's what we'll do. But I also accept that I'm probably not the best person to say how we should organise treating people and keeping people well, because there are lots of clinicians who know much better than me, and I'm going to ask them to give the answer.
Thank you. Did you have any follow-up to that question?
No, not really. I just think that they're not in the room, but the NHS Trust provided some very odd figures for the likely demand 2 years ago. The likely demand in Hemel 2 years ago. They said that there would be a 6% increase in demand for the urgent treatment centre in Hemel, and a 30% increase for Watford, the emergency department. I think that's a bit strange. I don't know where those came from. All I would just suggest is that your officers and yourselves keep a very close eye on those and make sure that those figures, the figures they're giving for the demand, are well founded, because it would be, there are some very old bank packet calculations that seem to have been put forward by the trust in previous years. I hope they won't do that again.
And just to reassure you, I do look at the Herts County Council Joint Strategic Needs Assessment, which looks at population health specifically, regularly, and we have Dr. Fernandez here, who is representing. Are you here representing the ICB?
I am, yeah.
Yeah, and again, the ICB would also look at population, I would assume, and needs.
Yeah, absolutely. I mean, first thing, sir, I agree. I mean, the reason we are where we are is because we've been very successful at treating people over the last 20, 30 years. And, you know, I don't want to rule anything in and out. It is about looking at evidence and the best ways of looking after people. And there are a lot of models out there at the moment. Some of them very innovative. There's the virtual hospital for stepping up and down. There's hospital at home. There are a lot of different things that are out there that show very good results and quicker recoveries actually than many many other ways of doing things. So I think we have to bear those things in mind. But at this stage, you know, we are at the early stages, as James said, in terms of we're talking about estates, finance. You know, we haven't got to the stage of deciding what we're going to put into, you know, the health campus. So I think, you know, I think, you know, the aim will be to look at the evidence and see what the best way of looking after people is. But, you know, the other thread in here is the only way to keep things manageable is by also focusing on prevention. So I think we need to get out of that sort of focus on having more and more beds and work harder on the prevention. And that should be part of any campus.
Thank you. And my colleague, Councillor Smith-White, also wanted to comment as well.
I'd like to echo what you've said, and I think whatever health prevention we can offer residents is a massive step forward, because I think it's not just about the hospitals, which deal with patients at crisis point. It's how did they get there?
Yeah.
And it's lifestyle, it's food, it's mental health, and it's if the council can be in everything they do, think about, you know, residents being healthy people and encouraging wellness and exercise and healthy living. And I think as Australia and Japan and China, they all, that's how they manage their health systems. And I think we are all about crisis and managing crisis top down.
And just following through on that, I think since the ICB's come into place, those structures are now in place. And, you know, James will know we've done a lot of work on prevention between Decorum GPs and the council. And what you work out is that the areas that our statistics show we're not doing very well on, health-wise, are areas that the council actually has projects on, and therefore it's about channeling those projects and making people aware of those projects, the population who require those services, trying to point them towards them. So yeah, that's really important.
Thank you. Okay, Councillor Moore.
Following up from all that, in principle, I totally agree. I was diagnosed with type 2 last year, and I've just completely turned that around. Chocolate, cake, biscuits addicts, but my concern is that while the theory might be sound, the implementation, and just being pragmatic for a minute, you're talking about potentially a generation to change it all round. And that's 60 or 70 years or something, 80 years or whatever. The other point I'd like to make is, stopping people heading in that direction in the first place. But of course, a lot of people end up in hospital, A&E, just accidents and stuff. So I think there's several, and that's just off the top of my head. So I think there's several reasons why people end up in hospital. And I think just to say that, let's look at public health, for example, is just looking at one aspect of it all.
So you're absolutely right. And if you look at the statistics again, a lot of those people are the frail elderly. It's the falls, it's frail elderly people, and that's an area. I mean, government focused on it, we're focused on it, the ICB's focused on it, in that we all know money's tight, and there isn't going to be more money for health. And the only way we can actually come in on budget is to reduce admissions through A&E by probably quite a large percentage, 20–25%. And the way we're doing that, our main plank on that is addressing frailty in primary care. And so that's one of the big work streams at the moment for the ICB, and it is working with GPs, working with other pharmacists, working with the whole primary care team to focus on our elderly frail population, to try and reduce the amount of time that they, the amount of times they do end up in hospital.
And rugby players on a Sunday afternoon.
So I think if you look at the numbers, they're quite a small number compared to elderly.
And it's never too late to make changes in life, whatever your age, so just bear that in mind. Councillor Madden.
Thanks. Trevor, I was just interested in your comment about the new house campus and that you're not sure what's going in it yet. Is that not the back to front way round of doing things? Should you not look at what you need and then decide where we're going to have a building that's going to be the right size? That would, to me,
parameters, I think,
logic.
that include finance and space, and therefore we have to work out what we can use, what we can put in there. We haven't got unlimited finance to build as much as we want.
No, but it still seems the wrong way round to me.
Well, we're entitled to that opinion.
Fair enough.
Thank you.
Chair, just to assist with this, I mean, this is what the next stage of the feasibility will do. We'll have that deeper dive into what the NHS actually do want to put in there. Now, at the last meeting, I was just outlining to members that the high-level work done last year made some assumptions, again, from the NHS bodies about to get a sense of, can the building be fitted on there, what's it going to look like, what's the approximate cost, etc. So, but we've got to refine that, and I think there's a further piece of work. So it comes back to Philip's question, I think, really about, well, how do you then plan for the future? How do you future-proof it, really? But again, what would I expect with the design when we come up? It will probably need to be designed on a flexible type of basis, really, so you can adapt it over the years, really. But we'll have to explore all these in detail. That's the whole point of it.
No expert on design.
No.
Thank you.
Do we know if we heard that the new incoming government was going to review a lot of NHS projects to see whether they were still financially viable, etc. And I wonder if this one is included in that. Do we know anything about possible review by the
My
incoming
understanding
government?
my understanding was that was around the new hospitals that were being built. So as this is a health campus,
Yes.
it wouldn't fit within that criteria. That's my understanding, but I could be mistaken.
It's always been my understanding, and one of the attractions to me of pursuing this line of doing the health campus is that it was honest, it wasn't embroiled in the Boris Johnson nonsense about 40 hospitals, because let's all be clear around the room, it never happened, right?
No, I just wondered if it was in fact
Yeah.
broader review of just the 40 hospitals.
Yeah, I think the projects that were in those, around the country, that were in those big hospital projects, it's my understanding that those are being reviewed. But the health campus isn't, because the health campus will be funded by the ISCB.
I mean, I would imagine all health services are due for review by the government anyway. I mean, I hope I'm not speaking out of turn there. I'm sure David Taylor can correct me. But I would imagine a new government would review the NHS as a whole and everything that entails.
Yeah.
Did you?
Chair, I was just going to add to that I think, you know, it's useful to flag the question now, but until we know what we're actually looking to build there through the next stages of the work, really, I'm sure there will be then a part of the scope of the work will be to have a funding strategy, really. So then that may well be an ask to the Department of Health at some point, looking at David and so on. But it may look at other models as well, you know. So we did touch on this in some of the earlier feasibility work, but let's understand what we want to build first.
Thank you. Councillor Hannah.
Chair, look, from my point of view, we spoke about it yesterday at a meeting that we had of the constituency Labour Party. Our commitment is to enhance the services we give to the people of Hemel Hempstead and make certain that people in Hemel Hempstead, you know, and the parts of Dacorum that use this area, because I do realise there are other parts of Dacorum that their closest hospital is Stoke Mandeville. What we want is, we would like to see residents in Hemel Hempstead being treated in Hemel Hempstead, having alternative care pathways that mean that they don't have to leave Hemel Hempstead wherever possible, and only in emergency situations would they find themselves moving outside of the town. And we think that even in a reformed model, that's what is achievable in the NHS moving forward. And you know, from what I've seen as a clinician over the last 30 years, is fewer people are per contact that I make are going to hospital, because of the fact that we've got far more alternatives than we had when I started as a paramedic in 1994. And the only way the NHS can survive is if we enhance the ability to have alternative care pathways so that people are treated closer to their homes than they currently are.
Thank you, and I would agree with that as a clinician as well. I think
Can I get comment on reference to Stoke Mandeville is the minutes that we did see, the video version, I did interrogate them to find out, because I wasn't quite sure what the answer to the question I put about the catchment area of the new hub. And the answer was not the bits of Dacorum were omitted, but you remember this as well, Caroline, that it would encompass all of Dacorum. So that's what I expect to happen, to be quite honest. Thank you.
Thank you. Edie.
Hi, I think we've got a little problem here with being closer to home. It isn't happening. What's happening? I hope somebody from the trust is here, because people are being directed or being given outpatient appointments in St Albans instead of in Hemel. And I've heard of a few cases like that. There was respiratory. I've heard of another one today where somebody's going to gastroenterology outpatients in St Albans, where the parking is abysmal. And I think this is what the trusts are doing. At the end of it all, we'll have nothing left.
Thank you, Edie.
We can check on I mean, sometimes I think what we find is capacity isn't quite enough, and therefore if people need something a little bit more urgently, they might have to go to somewhere else. But I don't know the individual cases, but that's often the case as far as my patients have been. Or the specific consultant they need to see has got a clinic there soon. You know, there are a lot of factors that come into it. You can't have every consultant in every clinic every day. You know, it's not going to happen.
Quickly, unfortunately, I was quite ill a few weeks ago. I had a lung infection, and it was so bad. My daughter had to call an ambulance one day, and I was taken to Luton Dunstable, which is a different under a different hospital trust, I hasten to add. But the treatment that I received, we did actually question, my wife and I did actually question, especially initially, could have been done at my GP just up the road. And all the logistics involved, a 3-team crew, the resources, the whole lot, could have been done at my doctor's. It could have been done at my doctor's, you know, and it's very frustrating sitting in meetings like this, requiring urgent help, you know, and actually, you know, stepping out and looking at how it's all playing out and everything, and you think, it's not about money, actually, it's about organisation, isn't it?
Organisation, and I think some finances as well, because I think we have to recognise there is a shortage of GPs. There's been quite a mass exodus abroad because of some of the finances and structural issues. So that's probably impacted.
I just agree with what Peter said earlier.
Yeah.
But again, just talking from experience a few weeks ago, it's really frustrating. It shouldn't really be like that, should it?
Shouldn't be. If you're chair, if in my view, if I go to somebody who needs to go to hospital because of their SATs are low or their RESPs are high, then I'm going to take them to A&E. I'm not going to wait for their GP to book an appointment for them. That for me seems like an emergency. However, if there's a situation that's not time critical, I'm not dealing with a time critical patient, then I'll very easily get on the phone. I've got the backdoor numbers for all the GP surgeries in Kensington where I work. So I'll be able to get onto the GP and say, listen, if you want, I'll take the patient to you. I'll bring the patient round in the ambulance. There's no problem with that. My trust would be well happy to avoid a hospital admission.
Yeah,
if it's during the day, I can't do anything at night time.
I know we're a scrutiny committee, but if there's some way we can, you know, encourage things to happen like that. I mean, you know, I won't go into detail, but I was put on a nebuliser by the ambulance crew, so I could actually walk downstairs. And after that, I could have gone to my doctor's.
It wasn't you're on a nebuliser immediately. I think that you should have gone to hospital personally, but I mean, I wasn't there.
Yeah, again, there are a lot of protocols on this kind of thing, and although you might feel better instantly, the advice in that situation is a bit like using an EpiPen. Although you feel better, the advice is that you need follow-up for a few hours because things could relapse quite quickly.
Yeah, but it's okay for me to wait in A&E for 4 hours. That's all right.
Someone there.
But again, this is where a hospital at home type service can be quite crucial, because they might give you the monitoring equipment to stay at home, but it's connected to a system where a clinician has oversight. So healthcare is changing, and I think it's about us being flexible, seeing what's ahead, and we work together to say, there's a good model here that seems to be working. Can we bring that to decorum? Or has anyone tried this? That's the whole point of this committee. Have someone from the ICB here. I'm sure Trevor feeds back. We have David here. You know, this is about us all working together and coming up with ideas. Thank you, David.
Well, Chair, just on that point about working together, I'm very keen to do that. I mean, I welcomed the announcement initially when the health campus was first mooted, partly because it was there was a bit of cross-party consensus, wasn't there? So my predecessor, Mike Penning, was supportive of it. It was put forward under the Dem Council with the support of the Trust. I've been in discussions with Adrian, Kathy, and also James and Claire about it. Initial conversations, I should add. People may be aware that I met with the Trust several times as a candidate, and I have not met with them since I was elected yet, because I was waiting for the publication of the Darcy report, which, as you know, is a major report into the state of the NHS, both what's wrong with it, but also where we go in the future. So I am seeking to meet with the Trust again to discuss the implications of that report. I'm also waiting, frankly, as I've made clear publicly, that I am taking my time to recruit my team, because notice periods are notice periods, but I am hiring a senior parliamentary assistant who will join me at that meeting, because together we're going to work very closely to try and push this agenda going forward. My position hasn't changed since the election. I think that's still on my Facebook page. Everyone can read it. There was a letter that went out to constituents that set out my position. It is largely supportive of the health campus, but pushing for some more ambition. I've all along not taken an ideological approach on this. I think guided by what will work. My current view, based on the advice that I have been given based on the meetings I've had, is that the plans could be a bit more ambitious, particularly along the lines of rehabilitation beds. And that is something I will raise with the Trust when I meet them again. But as I say, I stress I'm not here to score political points. I do want to work with all of you. I do want to be guided by the evidence and what the advice is saying. In terms of meetings I've had and so on, I haven't yet, and neither has my Watford colleague, had a meeting directly on the with the health ministers on the decision to review the 14 new hospitals. So I'm afraid I can't share an update on what's going to happen vis-a-vis Watford. As soon as I have something to share, I'll definitely, of course, share it with this group. But I have made ministers aware of the needs that we have in Hemel as a growing population, and how aligned, and I said this to Wes and his advisors during the election campaign, the alignment that is there between our commitment and our manifesto for more neighbourhood-based care and neighbourhood health centres, and there's some striking similarities with what some of the plans are for the health campus. So I do think that, in theory at least, we're all broadly, national government and everyone around the table, working towards a similar goal here. Obviously, there's going to be, rightly, debate about the specifics, and the feasibility study, as James said, is really important in that. So, yeah, that's a sort of update for me, if that's helpful.
Yeah, really helpful. Thank you. Thank you. Okay, so we'll move on to ward issues. I'm aware of a couple of things that have come in via email. I'm not sure if they've been shared with people already on the committee, or
I have emailed them, but I'll attach them to the minutes as well.
attach the minutes,
Yeah.
okay. And I know Councillor Mitchell had something. I'm not sure if she handed it over to you, Councillor Hannell.
She did, yes.
She did. Are you happy to? Do you want to?
Yes, it's a Gatebridge ward issue, but I'm happy to talk on it.
Yeah, that would be helpful. Thank you.
So Councillor Mitchell would like to bring to the attention of the Health Committee that the residents who are registered at Parkwood Drive surgery, which mostly covers the areas of Gatebridge, but also Warner's End, are having a lot of difficulty in accessing routine appointments at that surgery, and they have been experiencing this for a long time. Appointments are only being released up on a fortnightly basis, and if you miss the release, you can end up waiting a month or more to make a routine appointment. In addition to this, patients are waiting an excessive amount of time in the queuing system for their calls to be answered. There is a Patients of Parkwood Drive group that's been set up by a local resident who is the administrator of Hemel Hempstead Community and Conversation Group. Councillor Mitchell would like to know what help and support the committee can offer the patients of Parkwood Drive and herself in liaising with the practice to find a solution on these issues.
Thank you.
Well, I mean, first of all, I think we've mentioned quite often at this committee that this is a good opportunity for us to raise those points for the people in the room. And I know that Kathy, as chair, has really worked hard to, and with great thanks to you, Trevor, because you are here. Tonight isn't the best example of all Kathy's work coming to fruition, but the intention is that these meetings become meetings where we've got people who need to hear adult social care stories from the core room, who need to hear these ward issues, and they literally get said in the room. And now that we have video minutes, they can be shared readily with whoever needs to see them and just watch that story being told. I've worked in bits of the NHS in the ambulance service in communications teams, and I know how important it is to the NHS to hear stories from real people. So, I mean, this committee can help those stories come to the surface. In relation to the Parkwood situation, I mean, we need to recruit more GPs, don't we? Because if we have more GPs and the ratio of GPs to patients is better, people will be able to get them.
Yeah, and I wonder, as we have the integrated care board here, is this something you would be able to bring back to quality teams within the ICB?
Yeah, it is. I mean, for the record, yeah, I obviously worked at Parkwood Surgery for 32 years. I no longer work at Parkwood Surgery. There have been for a number of, for years, issues with, a couple of years, issues with recruitment and retention of GPs, mainly due to workload. And, I think they've tried to support with, pharmacists, paramedics, other members of staff, pharmacists. But yeah, I'm not sure that there is as many appointments as there need to be. This has been, the primary care team at the ICB are aware of this. They have made a couple of visits, but I'm not aware of the plans at this point. Hasn't been fed back to me.
Would you be able to feed these comments into that team?
Certainly, yeah.
And then if they can provide some sort of response to that would be helpful for us as a committee, what their plans are, because I think that's...
So I know they've done a couple of visits, trying to help, improve the situation. But I don't know the outcomes of them.
So thank you. Kevin. No, well, Kevin was first, and then I'll come to Heather. But I know it's also Heather's ward, so part of Heather's ward. So I don't know. Was your question on the same issue, Kevin? Or?
It was a bit of information. Basically, the patient participation group at Parkwood Drive was excellent for many years. It's a shame that somebody in the community has had to create their own sort of Friends of Parkwood Drive in that way, and so that's very sad as well.
Thank you.
It's not just Parkwood Driving having this problem, it's most of the GP surgeries, it's everywhere. And people need to be aware it's not just one specific surgery, it's generally.
Yeah.
And there's a lot of change afoot, and I think we need to see what happens.
Yeah. Thank you.
Can I speak? Tring, I'm quite really impressed with Rothschild surgery, having moved from Aston Clinton surgery, waiting on, with the same problem, waiting 8 o'clock for an hour to be answered, and just exact problems that's just been explained. Rothschild surgery in Tring seem very, very efficient. They've got Pitstone, and I know that's not in our area, and Berkhamsted, and you get an appointment and you have to wait a little bit, but if you need to see a doctor, they'll see you on the day. So I've been totally impressed by them. So I don't know if there's a way that we can actually learn what they're doing.
I mean, I certainly found my GP, I'm not going to name it because otherwise everyone will move to it and then I won't get an appointment. My GP surgery in Hemel is certainly, I will get an appointment on the same day. I think what's important is from a public perspective who's recognised, the appointment will not always be with a GP, rightly so. It's not always appropriate to see a GP. So we have now within primary care, within GP surgeries, there's paramedics, there's nurses, there's allied health professionals, we have social prescribers, and a whole range of professionals who we may go to see first. And only if someone really needs to see a GP would they then go to a GP. I think that message hasn't got through to the public well yet, because people will say, oh, I don't want to see a nurse, or I don't want to see a paramedic, I want to see a GP. For some things, for example, a wound, actually the GP might not be the most appropriate professional, because the practice nurse might have more expertise on that. It's not to say, I mean, a GP has lots of skills and expertise. There'll be things that there's mental health professionals based within GP surgeries, so they may have more expertise around mental health than a GP. So I think as members of the public, we need to start recognising when we're booking an appointment at a GP surgery these days, it's not always with a GP, and rightly so. But I think it's positive that Dr. Fernandez will feed that back to the ICB. We'll get a response as a committee, and that's exactly the sort of thing we do need to be raising here, because we need these two-way conversations. Thank you.
Can I just come back on that, because I think that we wouldn't bring a ward issue here if it wasn't an acute problem particular to Parkwood Drive surgery. And so from my point of view, I'm going to cop a lot of stick from the people of Bennetts End, but saying that Bennetts End are coping tremendously well with the amount of demand that they've got in their area. And also in Adeyfield, where the Labour group represent, and also in Grove Hill, where the Labour group represent, aren't seeing these types of acute problems that we're seeing in Parkwood Drive. So I do realise that there are some problems with recruitment and retention of GPs, but there seems to be a particularly acute situation at Parkwood Drive that has been reported to me. And when we'd openly discussed it amongst the very tiny Labour group, we came to the view that particular situation wasn't happening in any of the other wards where we represent.
And also, just a reminder, any member of the public is welcome to contact CQC or the Integrated Care Board directly as well, should they have concerns. So just a reminder.
A really quick point. This is, I feel like this meeting has been has been some interesting discussions on some good points, and I think it's been very watchable, and it is watchable. And perhaps we should share the link of this conversation for the people who are looking at the GP surgery issue, and they can see that we've discussed around it. We've heard from Trevor, and we've looked at different sides of it, and I think it's really important that we encourage the public to come into this room and hear what we're talking about.
Thank you. Okay, so any other ward issues?
Okay. I've got, I received an email from a colleague, and it's from a resident, I think it's in Adeyfield, and partly distressing, and questioning the fact that she was asked to beg for some equipment, and I need to pass this on to somebody who might be able to deal with it. I've printed out the email, and I've noticed that the person who sent it works for a security, for the security services, so I need to send it without the contact details and things.
Okay, so I think maybe it probably needs to go to the County Council or Integrated Care Board or CQC, depending on what without knowing the content, it would be hard to say exactly where to send it, but...
Well, I don't really want to read out the whole email.
No, and it wouldn't be appropriate under the circumstances, but I think I'm happy to discuss with you afterwards,
right,
but I think Herts County Council, if it's around medical equipment,
right, thanks,
then they're probably the people. Thank you, and Councillor Hannell.
Yeah, Chair, from Bennetts End. Unfortunately, the situation with the overflow car park continues to be an issue, and it's not just an issue for Bennetts End, it's an issue for all of the wards that feed their patients into Bennetts End surgery. And also, if you come to Bennetts End surgery, and you're very welcome to come, you can see a tremendously thriving social prescribing hub, and they are fully on board, I think, with everything that Dr. Fernandez wants in a GP surgery in Hemel Hempstead. I would go so far as to say they're the most progressive GP surgery anywhere in Decorum in terms of having a social prescribing network that socially prescribes females to the female-only gym. If there's a barrier to them exercising, they go there. And also to exercise classes and healthy walks around our fantastic Coronation Fields. Unfortunately, when patients who are prescribed Bennett's End to do things like Councillor Binder was describing earlier, to stop them being on medication for diabetes and get their weight down, because sometimes it is about weight, and they get their weight down and they can be off of drugs like metformin in a matter of 6 months, and they can turn their lives around. This is the kind of reformed NHS that Dr. Fernandez and Aaron Darcy want moving forward. However, what we've got is we have to use the overflow car park because of the fact so many people are driving to Bennett's End to use the facilities that we have at the community centre and the Healthy U gym. The overflow car park is in a terrible state, and unfortunately earlier in this year, a patient fell over. Luckily, she didn't seriously injure herself. Well, we thought at the time she didn't seriously injure herself, but she did chip her pelvis. The Borough Council, the main problem is that we didn't actually know who owned that land. But now we do know who owns that land. We know that the Borough Council own the land. And we've also been able to get an estimated long-term cost of repair of £100,000 to change it from its original use, which was as a tennis court back in the 1960s. The substrate is just not sufficient to be able to hold the kind of large vehicles that the people of Bennett's End now drive. There is a short-term solution, which is estimated at £25,000. And the Bennett's End Community Infrastructure Levy is quite prepared to contribute a huge amount of money to that. But it's unfortunate for Bennett's End that we don't have that kind of money in our SIL. So what I've done is I've written to the portfolio holder for neighbourhoods, Councillor Bromham, who's also my next door neighbour councillor. I can throw a bandage over to Leverstock Green from the GP surgery, so it's not far away, and asked, can we all get together and see if we can get a fund together for a short-term fix to get us through the winter, so that then we can make it to a long-term fix for 2025. And then we can continue to be the kind of reformed NHS social prescribing hub and receive our patients from all over Hemel Hempstead as we are doing. My fear is that we might have to cut back on social prescribing because of the fact that the car park then gets to such a dangerous state that patients fall. And as we all know, Kathy, you know as well as anybody, that if you fall and you're over 85 and you fracture neck or femur, your chances are this is your last Christmas. So, I don't want to, they live for less than 12 months, the over 85s. And these are the kind of people that are visiting a GP surgery to get better. So all I can ask is that you listen to us and we do this effectively, collectively, for the population of Hemel Hempstead.
Thank you, and I'm aware that that issue has been raised because obviously neighbouring ward, Councillor Madden's also one of your neighbours as well.
Literally just wanted to echo everything that Pete's just said. It's most of the people in Lush Mills go to Bennett's End surgery as well, and I always used to park around the back of there, and now I park out on the road and walk in because I won't walk across that car park. It's really dangerous.
No, I absolutely agree. I think that one of the challenges is it's not actually a car park. So I appreciate we're calling it a car park.
Yeah, this was an argument I had with the officers because they're saying it's not a car park. Well, it might not be officially a car park, but it's been used as a car park for 27 years that I know of. And in the sort of scheme of things with most councils, if something's used for something for X number of years, it becomes that thing. So surely it is a car park and we should be doing something about it urgently.
I'm I'm aware that it has been raised with portfolio holder of neighbourhoods, and it's definitely something that officers are aware of. So we'll mention it's been discussed tonight again and see what updates we get from that. So thank you for raising that. And then I think other ward updates will be on the, I'll look at Jenny, there'll be a summary of.
Yeah, they've been circulated, but I'll attach them to the minutes as well, so you can.
Okay.
Can I just mention one last thing quickly, Chair? A couple of weeks ago, we had an event in Grove Hill, and at that event, it was a community thing, and at that event, I didn't know about this in advance. Dacorum Borough Council launched this booklet, coincidentally, Change Your Life, Diabetes 2, you know. It's a little booklet. It's actually done. Absolutely amazing booklet. I actually sat down and read it, and I was so impressed. It's good language. It's funny. It's got really useful information, which I didn't get from my doctor when they told me I was in trouble. You know. And I was really impressed. So I'd just like to, hats off, commend the author and DBC officers who did that. I think the officer that was there, Helen was her name.
Helen Wotton-Rowe.
Yes, indeed. Thank you very much, Chair. And what an amazing publication.
Yeah.
Absolutely amazing it was.
So, and just for context, that was joint projects with Herts County Council for Public Health, and I was at the event, David Taylor was at the event, and it was for the Asian community. It's recognised as higher rates of diabetes. So a cookbook was made, but there was also live cooking demonstrations for the recipes within the book, and the community engaged. They enjoyed it. It was a fantastic event, and obviously perfect timing for yourself. But that is what we talk about when we talk about prevention, because if we can make a difference and we can get it right. So when we hear good work like that, that's what we want to emulate and do more of. So there are more things like that coming up. And certainly that book has been something that, I think is fantastic as well. For the
and just on a side note, Chair, while we've got officers here, the idea of launching that through an existing community event was really clever. I thought that was a really good idea.
Thank you. We'll make sure that's fed back as well to all the people that were involved in it. So, thank you.
Chair, I just want to add that I thought that booklet was fantastic. It's really good. And it was a really great event as well. And just on a similar note, literally because it's fresh in my mind because I was there earlier, I was shown around the Longdean Reserve with Wildlife Trust, and just to say that they are very keen to be involved in any of the social prescribing efforts that happen around Hemel, because obviously they're keen to encourage more Hemel residents to be visiting their reserves and being active. So just
Thank you.
That as well.
Thank you. Karen, you put your hand up and it's gone now.
Well, I think it's good that we're saying good updates in lots of ways, and for the minutes, as we've been talking about, we've got Absoling Corner Hall as the ward update. Residents have been enjoying utilising the local green spaces in the ward. In particular, there's been increased use of Durrance Park, where Boxmoor Trust have a beautiful planting and some play equipment for residents to enjoy. It's a beautiful spot where you can sit by the canal and reflect, which is so good for mental well-being. It's been lovely to see a new park for children to enjoy opened by the marina. It's wonderful to see children and parents enjoying some quality time together, keeping active. I just wanted that for the minutes.
Thank you very much. Thank you. Okay, so we'll move on to, well, next on the agenda is West Herts Hospital Trust. They're not here this evening, but I think, I'm not entirely sure why, Jenny, what was because I know there was a change of staff, wasn't there?
So I emailed Louise Halfpenny and two colleagues. Louise Halfpenny has moved on. And didn't receive a reply from the other. I don't think James did either.
I've raised this with Alex White as well, who's the director leading on both Watford and Hemel and St Albans sites actually, but no response, Chair, sorry.
So, and just to clarify, so the Alex and Toby, their role is more around health campus, but we were looking for generic representation for West Herts. So they will still come when we do our campus updates, but it's more about generic representation moving forward.
If it's helpful, a new Director of Communications called Nick Foley.
That's very helpful, thank you.
Why not try getting the Chief Executive to come once as well? Nick is a PR man. Nothing wrong with that. I used to be one myself, but just saying.
We can invite them both for the next
I think good idea.
attend. I'm going to go to Kevin first because he had his hand up first.
I believe at the last meeting with the two people that we just talked about on the health campus that the experts by experience, the patients were going to get contacted about being involved in that sort of process of what it should be used for, how it should be used. And just for the record, I haven't been contacted.
Okay, that's useful to know because that's definitely, I know there were conversations about communications and co-production, so that's something.
It's just that we've still got to bring our project manager for the project at the moment, but that will be action. Thank you. Clear feedback from last meeting.
Edie, did I see your hand go up?
Right, I'll just fill the gap on West Herts Hospitals Trust. At their board meeting on the 5th of September, there was a lot about the health campus. And there was something called a memorandum of understanding, which wasn't talked about, was it, at the last meeting here? But it makes interesting reading, and I have some concerns about possible outcomes. The first thing was a statement that decisions shall be made by consensus, failing which matters shall be determined by each party representative having one vote. So that's the ICB 1 vote, DBC 1 vote, Trust 1 vote. Every time it's going to be health which will succeed because there's only one DBC. So you're going to lose out on every vote. And that doesn't seem fair. And confidentiality, there's a big section on confidentiality. The provisions will survive the expiry or early termination for whatever reason of the Memorandum of Understanding for a period of 3 years. That means, should it be terminated, nobody's going to be able to talk about it in any of the confidential papers for a whole 3 years. Seems a long time. On publicity, positive publicity has its merits. Those are all quotes from it. But they agree that no individual parties may make any press announcement or public statement about the project or this MOU, which has not been agreed in advance by other parties. So you can't write a press release yourself without it being seen and approved by the ICB and the Trust. Is that right?
I'll defer to my colleague, Councillor England, to answer these questions.
So, I mean, look, I hear what you say, and I always listen to you, Edie, because I know that that's important in this town. But it's like a telescope. You can either look it down it one way, or you can look it down it the other way, and you'll get a completely different experience. My philosophy is that if you want people to make decisions and you want to influence people and you want things to go your way, the way to do that is to build relationships with them, build trust, give them confidence that you won't always be dragging them through the local Facebook group. I mean, newspapers don't really exist anymore, do they? And that's my philosophy. It's not because I believe in giving people an easy ride. It's because I've seen that it works. And you know where I'm going to say it works. It worked a dream in Watford. Watford, the local politicians of all stripes worked with the NHS. And the NHS has recognised that it's a safe space. And they've that's probably I can see that's going to be in Phil's next post. I should probably withdraw that and say, because they recognise that they can sit in a room and they can say, look, this is really hard, but we're trying to do what we think will work. And what I'm looking to do with the Health Campus is to use the fact that Decorum has some land to get us a seat at the table. Now, you mentioned that a third of the votes are ours. So there are 3 votes, and one is Decorum, and one is the ICB, and one is the Trust. And that's true, and I can't change that because a third of the money is coming from Decorum, and a third is coming from the ICB, and a third is coming from the Trust. So, I mean, everybody in this room knows who pays the piper, calls the tune, and who puts the money in gets to make the decisions. If I had come to you and said, I want Decorum to put 2/3 of the money in, but the good news is we'll have 2/3 of the votes, you would have said, why aren't you getting the NHS to pay for this project? You would. So what I'm saying to you is the NHS is paying for 2/3 of this project. And yes, they have 2/3 of the say when we come to something that we can't agree consensus on. But I think the number of times that happens is going to be really, really small, if at all. This is a memorandum of association, of understanding, so that we can work together as 3 partners. And that's what MOUs are for. So there's no conspiracy. It's just that we are working together for a period of time. And a responsible organisation like Decorum would absolutely have an MOU in those circumstances.
Thank you. Thank you. Oh, we've got some hands. Who went up first? Sorry.
I did.
Okay.
Oh, were you? Oh, go on then. I was the first one.
A couple of things.
Yeah.
I'm really sorry, Councillor England. That sounds like childish to me. It sounds like children's games, but if that's the way we have to do it, that's the way we've got to do it. It just sounds a bit childish.
It's governance.
Don't say that. God, okay. What I wanted to say was that while we've got David Taylor MP here, and as he's already said that he's had a couple of meetings with West Herts Trust, could I be so bold as to request that he uses his influence to try and get West Herts Hospital Trust to this table?
We could certainly ask for it.
Because they haven't been here for a long time.
Well, they have been, and I think we need to be really clear. West Herts have been here more times in the last year than they have been in several years before that. So I think they have been, and I think the relationship with West Herts has changed from what it was, and I think it's about looking forward, and we will all be communicating with West Herts, with the ICB, with each other. So yes.
Okay. I mean, you know, as has been said around the table, the issues that come up and everything, you know, it's really good to get the right ears hearing that stuff, you know.
Thank you. Councillor Madden.
I'd just like to take Councillor England's comment to task on the fact that the Watford councillors, MP, etc., all feel very comfortable and cosy with the trust. Of course they do. They're the ones that get in the hospital. You know, it's like saying if we're nice to them, then we'll end up with it having a lovely. They're getting a hospital, and that is why they're happy. If that hospital was going to Hemel, they would not be friends with the trust. It's as simple as that, Adrian. So I'm sorry, that was a really strange thing to say.
Well, it's incumbency, isn't it? They had a hospital.
They had,
and
yes,
they
absolutely, they did. And yes, I agree with that, but so did we, by the way.
Yes.
So did we.
And the history is that everybody knows is that in Watford, I'm not here to speak for Watford Lib Dems, they're a separate local party to mine, and I don't have any responsibility to speak up for Peter Taylor. He has his voters and we have our voters here, and that's how it works. But I can say that when I became a county councillor with my other hat on in 2021, the first thing that I asked of my group was that they all came and listened to me tell them that we ought to consider having a greenfield site. And as a result of doing that, I'm not saying I was happy about it, but I heard their account of the previous years where they had built Tom Sawyer Way in order to make the access to Watford Hospital credible. And they faced incredible political opposition for developing over the top of those allotments.
Yeah.
And it wasn't an easy thing to
But
do.
your comment was that all the politicians are sitting very comfortably and very happily with the trust and the ICB. Well, of course they are. That was my point. Of course they are.
That's putting words in my mouth. That's not what I
Thank
said.
you. So I think what we're going to do, I appreciate that comment, it's noted, but I think we're going to move on, because what we don't want is this meeting to be overtaken by the hospital, especially when we have specific health campus update meetings as well. So I think we'll move on unless there's any more specific points about the hospital. Okay, so I appreciate you being part of the discussions all throughout, Dr. Fernandez. Any further updates from the Integrated Care Board to share?
So,
Covered.
I mean, the main thing with the ICB is there's been a bit of a restructure, mainly in an attempt to save money. So I'm now a partner member of the ICB board, so I'm not specifically representing South West Herts. I am a primary care overview for the whole of the Herts and West Essex area. There is a new decorum primary care lead. It's Penny Sisu from Rothschild Surgery. I think I only told him about this today because I only knew about it today. And he said he'd probably be happy to come in the future, but wasn't available today. The key thing is, as we've heard, there are a number of reports coming out. There's a Darcy report, there's an NHS 10-year plan due out very shortly as well. So it's a sort of period of sort of stepping back a bit and seeing what's coming down from above, and therefore then trying to sort our plans out accordingly. There are already sort of 5-year plans, and again, one of the big pushes, as I said, is the frail and elderly. There's children and their sort of waiting times, especially on things like ADHD and ASD. And there's prevention, absolutely massive. So those are some of the big areas that we're working on, and trying to keep within budget. So, one of the big areas of trying to stay in budget is trying to reduce emergency admissions by 25%. And that's why the big focus on the frail and elderly. So those are the key work streams. There's a lot going on in mental health as well. Again, trying to improve access, trying to, a bit like the social prescribers, spread out a bit, use the voluntary sector, because there isn't enough capacity within the pure psychiatry sector or the children's and young people's mental health services. So we need to use all those other agencies appropriately. And that's beginning to happen. People are signposted things, and rather than getting fed up about it, they're actually using these other services who are providing very good services for them. So it is about, those are the main work streams. It's about care closer to home. It's things like the virtual hospital, which David's seen, things about like the hospital at home to try and prevent admissions. The main problem, as you've heard me say for probably 5 to 10 years, is that primary care is under a lot of stress. General practice is under stress. Almost what I was predicting 5 years ago is happening at Parkwood Surgery. I've been blowing this trumpet for a long time, and unfortunately, we are there, and it isn't just Parkwood Surgery, but other surgeries are struggling, amalgamating. So I think there are difficult times ahead, and yet GPs are feeling overworked and stressed. They're taking various actions for in their point of view, safety, and there are in other countries, people probably, GPs would see 25 people a day. And, you know, one of the actions that GPs are considering is doing that in this country. Now, at the moment, yeah, I was, certainly when I was full-time at Parkwood, was doing probably 50 to 60 consultations a day, face-to-face, online, on telephone. You know, it was grind. And at retirement age, I decided that I probably could have worked longer if it was a bit easier, but I couldn't carry on at that kind of pace. So, you know, that's my reasons for leaving. So I think there is a big challenge ahead, and we have to, see how we can manage that. But again, the ICB is aware of that, is trying to work on modern general practice. You know, we have to accept that more will be done virtually, by telephone, by online consultations, and also by other members of the primary care team. So the pharmacists, the first contact physios, who often know more musculoskeletal medicine than GPs, paramedics who are very good on the urgent, on the day stuff, the nurse practitioners who, again, have certain skills, whether it be diabetes, respiratory. So it is about using those whole teams. So those are all the big areas that we're moving forward on. I haven't got anything else specific to say at the moment, I don't think.
Thank you. Got a question?
Yeah, well, one thing is an update. I heard the other day that for children, mental health is a big issue, as we know that. We are having a group coming to Hemel that come in and provide support and education, a bit like summer school, that sort of thing in a way, but really builds up their resilience. So that's the thing that well done, whoever got them to come here next in that respect. But from the point of view of what Dr. Trevor was saying there, is that I'd like to hear a bit about the integrated neighbourhood teams. You know, we've done a lot of work on population health management. What do we think are our biggest problems here?
Miss that out. That's another area that we're developing. I mean, you know, in CCG days, it was mainly about the GPs, whereas now, round the table, you have everyone. You have the mental health team, you have the community trusts, you have the acute trust, and yeah, a lot of the things. So that event that you'd been to was discussed at a meeting the other day. So we are all working together more. And going back to what we were saying earlier, the whole point of the ICB thing was CCGs, we commissioned health services. We basically told people what to do. And we sort of, everyone was working in silos. Whereas the whole point of this reform, which is now beginning to motor, it's been in place 2 years. These things take time, is that everyone is working together. And so, you know, so we have people working together. So we were hearing about things called active practices. Now, you probably know about that. I don't know if anyone else does. And we were starting to do all this at Parkwood before COVID. Yeah, we were about to engage in park runs. We had a nurse, someone who did health walks probably once a month. You know, so all that kind of stuff. We were signposting people to exercise classes, all of that. And you know, COVID put it all back. Now we're a bit understaffed. But active practices, again, we're trying to encourage that. So encourage not only us to encourage activity for the patients, but to actually get the staff more active. You know, simple things like, you know, instead of using the button, getting up and going to get your patients from down the corridor. You know, encouraging people to maybe cycle to work or walk to work. You know, all of those things. Those are all the pushes that we need to do. So I appreciate we have to provide a service, but we also have to do all these other things. So there's a lot going on, and yeah, we have to sort of keep working at it together.
So Chair, I wondered
I'm just going to let David go. He did mention that he was going to have to leave as well. So thank you for coming.
I'm not making that serious.
Thank you. I was going to ask whether because I think it's very important, population health management. They've made a decision, our PCNs, our GPs, whatever the ICB, they've made a decision what they want to focus on for our different areas, our primary care networks, our integrated neighbourhood. They sort of overlap, but not necessarily one-to-one, I think. And it'd be really good to hear what they've decided is their key focus within different areas of our town, with different areas of decorum, to see what they're doing there. So it'd be nice to hear that.
Yeah, and maybe we could ask for like a formal presentation next time, because there's more to it than we wouldn't be able to get it covered now. So I think if we could ask for next time a presentation on
I mean,
that.
we do get, yes, we get the locality packs which have the information. You know, it is childhood obesity is one of the big ones. So at that event, I was also exercise for children, the adventure playgrounds. So again, we work closely with the council on that, trying to target it to the populations that don't use them at the moment and who have problems, you know, where we know the obesity problems are. So childhood obesity is one, adult obesity is another.
Cardiovascular.
Cardiovascular, so big push on hypertension, blood pressure, trying to get pharmacists doing blood pressures being done at events, that was being done. Blood pressures being done potentially in the future. Again, primary care is now opened up. We're responsible for dentistry and optometry. You know, people go to dentists, people go to opticians. Maybe they don't go to the GP for a blood pressure check. So maybe seeing if we can get them involved in offering blood pressure checks. So it's all about, yeah, that's again the prevention agenda.
Thank you. Before I come to you, Councillor Hannell, your hand went up and then it went down.
Well, what I was going to say was that, you know, that's a good précis of what, you know, the kind of neighbourhood schemes that you can employ. But, you know, at Bennett's End, I work with the Bennett's End Surgery to look at our population and the needs of the population, and also liaising with Longdean School, which is where the 3 primary schools of Bennett's End filter into. And what we came up with was definitely trying to improve the self-esteem of the girls at Longdean School, because what the head teacher was able to observe was he'd been there a long time as either deputy head or head teacher for 20 years, and he said that the amount of girls that were doing physical exercise had dropped off a cliff edge after COVID, and he kind of put that down to what he calls a very anxious generation and a very kind of judged generation through social media. So one of the things that we focused on in Bennett's End was to have a festival of women and girls physical activity, which was tremendously successful. And what happened is that Apex and Heart Sport Partnership and the GP surgery and Healthy U Gym, which is a female-only gym, got tremendous amount of contact. And Healthy U Gym are still reaping the benefits of that by being able to get girls to exercise and get sweaty without kind of feeling that they're being judged by boys who are exercising alongside them. And that was one of the things that they said was a barrier to exercising. So, you know, I just think that these kind of things are so important that we can live. The most important thing is to realise that we probably are going to live longer, but we're going to live more unhealthily for longer.
Possibly not you and I, because we work in health service.
Hopefully, you and I can look forward to an extremely short, unhealthy life. But nevertheless, that kind of, and Dr. Fernandez also would be in that statistic as well. But nevertheless, that's one of the things that I was very new to it. I'm only 16 months in, so I'm learning. But one of the things that you do is you identify what the needs of your neighbourhood are, and then you go and look with DBC for the pots of money that are there and available. You fill in quite a lot of forms, and then you get the money, and then you go with that and you try to make your communities more healthy.
That's where Helen does a great job.
Helen does a fantastic job.
Yeah, she definitely does. Yeah, she definitely does a fantastic job. So I want to speed us up just because it's getting late. So did you have an additional question?
I've got a lot to say, but I'm going to keep it really, really short. I'm going to go backwards. I think Peter's brought the Longdean Girls' School thing up before, and it's just made me think everyone must be aware about the, Jan might be able to help me out, the schools consortium in St Albans a few weeks ago banned mobile phones, and that's kind of slowly leaking into Hemel Hempstead. I've heard a couple of reports of schools, because mobile phones mightn't be unhealthy, but the effect of mobile phones is. That's the first thing. And there's something else that Trevor said, and it slipped my mind, but my original question, so interesting. My original question was, do you, as an organisation, look at other countries' NHSs effectively? And the reason I ask, because you mentioned 25 patients per GP per day, and the reason I ask is I've been to Germany a couple of times this year, and I know a lot of people from different backgrounds and you know, politics, medical science, all sorts of things, and everyone, I mean, they've got the same problems we have, and one of them is you phone up for a GP appointment and it's a 3-month wait. Slightly worse than us. I'm just interested in if there's other models around the planet we look at and think, oh yeah, that's cool, you know.
That tends to be done at a higher level than the ICB, I've got to be honest.
It's just that you mentioned
it's done at national level. But that's one of the things about, you know, the GP contract that is being argued about, which is a slightly different issue. And we have done that for, again, the neighbourhood type stuff in Spain. Can't remember the name of it, but basically there's a solution, something like that. And basically there have been visits there by members of the trust, West Herts Trust, and I think I can't remember who else. A few years ago, looking at those systems, and again trying to use some of those lessons in developing what we're doing locally.
And I've remembered the third thing, pharmacist integration. So there seems to be a big move now over.
So they're doing minor illnesses, they're doing blood pressure reviews, they're doing a lot of stuff for us. Yeah,
so I think that's,
and they're very enthusiastic about it. And COVID jabs, they'll be doing all those. So yeah, we're working much more closely with them now.
Thanks, Chair.
Thank you. One more question.
Just quickly, I wanted to say that I used to live in Australia for 9 years, and they had an amazing primary care system. We had a lot of GPs coming from the UK, so disenchanted. But you would call up, or you would just turn up actually, and you put your name down and you'd see a GP, you just wait. There were probably 11 GPs available. If you needed a blood test, you'd just walk up to the next, you'd get it immediately.
Can I ask you a question? 11 GPs, how many of them were Australian?
Oh, there was a whole mix, but we had a lot of influx, a lot of GPs from the UK. But you'd get your X-ray done on the same day, you'd get your blood test done.
Yeah, that was a sort of polyclinic model in Germany.
Yes, but I mean, you know, it's a Medicare system, so you pay.
Yeah, you pay. Swipe your card straight away.
Yeah.
And while I'm at it, something else, the national insurance that the Germans pay, we would laugh at because it's insanely huge. It's a different league, and that's why, you know. And if they're paying 10 times what we're paying, if not more, and they have to wait 3 months when they ring up for a GP, you know, kind of paints a picture.
And just to say another good news story, I do have a lung condition, and I was put on an amazing programme at Hemel, at the rehab for 6 weeks, and it was outstanding.
We have some great services here.
Yeah, I mean, so it's
we
not
sometimes focus on the wrong one.
It's not all doom and gloom. I've had exceptional experience in NHS.
And yeah, I mean, I travel a lot, and I've been in countries where I've needed medical treatment. I have gone into, because obviously I've got insurance, I've gone into a hospital. I've been in and out within about an hour with all the treatment, all the tests done and my medicine, but I've paid for it. So we have a choice. Do we want the NHS, which I think we do, I certainly do, or do we want to go like America, where if you have money, you can get the best healthcare. If you don't, you don't.
You don't think America might be the other extreme?
I mean,
we need somewhere in the middle. Perhaps.
No, I think we need a well-functioning NHS system. That's what I believe in, and that will not change. I don't believe that we should be. I believe in the NHS, and no, I don't want to go anywhere near like an American model or anything near that at all.
Good.
I think we've probably got, but I think we do need to move on. Councillor England.
Very quick comment. When the NHS was properly funded under Tony Blair and Gordon Brown, it was fantastic. We should go back to that.
So we're not going to go into politics too much in this committee because this is about us working
Scrutiny
together.
committee.
So,
Well, it's just something for us to reflect on.
Scrutiny
thank
committee.
you, Councillor England, but we'll focus on moving forward. Next item on the agenda is the County Councillor Health Scrutiny Committee report. And the Health Scrutiny meeting is tomorrow. So we don't have an update, but tomorrow we will. We also have County Councillor Adult Care Services report, which I have a copy of, but I don't know if you wanted to just speak to just a very brief update because people are getting...
I've pulled out a really quick highlight, which is the on the 5th of September, I think it was, the Adult Social Care, the Adult Care Service Complaints Report for 23-24. 35,949 referrals for care and support assessments, and a similar number of care and support assessments undertaken, and about 8,000 financial assessments, 23,000 care reviews, and 11,000 reassessments. Across all of that, the complaints received were 398, and the compliments received were 501. So the main themes identified were delays in communication, complaints about workers, matters relating to assessments and care plans. Communication was a key recurring theme in most complaints, and a lot of that to do with the complexity of the system. It's massively frustrating when you need something really, really badly and the system is a bit clunky. And that's what's going on.
Yeah.
Hope that helps.
It's really interesting stat because most people who have experienced something not very nice will complain, but few people will write in for a compliment. So that's actually quite a good stat.
Really positive. Thank you. Okay, so we'll move on now to work programme. Thank you. Thank you very much.
See you again.
Thank you. James, is there any update on the work programme? I appreciate we're missing a couple of people this evening.
We are. I'm going to raise that with them in the next few days. Yeah, certainly. Thank you.
And I think just from my perspective, the update really on the work programme is we are looking at more community events and things like promoting that recipe book and all of these types of really positive things as well. Adventure playgrounds, there's a lot of work going into them, and sport, there's work going into cycling. So there's a lot of positive things developing. So just kind of future reference, but when we have the right people here to talk a bit more about them, then they will do so. So, any other business before we close the meeting? Councillor Madden.
Just as well, Councillor England is here. On the Leighton Buzzard Road, I was very distressed tonight when I drove up here. It might have been there for a while, but I only saw it tonight. On the road sign, someone's actually whited out completely where it says that there's a hospital here. That's in your patch,
On the Leighton Buzzard Road.
As you're coming from the Magic Roundabout along the Leighton Buzzard Road, just past the Water Gardens car park, I think, there's a road sign, and where it says a hospital, and it used to be in red with a red H, and because obviously we had an A&E, then it was blue, and now it's been completely whited out. So I thought you might like to just take that up.
Thank you. That's a really important thing to raise. So thank you. Okay, you're all free to leave. Thank you very much. I'm around tomorrow in the day, so if you call me,
Kathleen, before you shoot,